It's Healthcare Week here on Euronews. 5 days of reports and articles exploring the future of healthcare. And in this report, we're looking at the European level. How does the EU see healthcare evolving as we emerge from the pandemic? I'm joined by European Commissioner for Health, Stella Kyriakides. Thanks very much for being with us, Commissioner. The Commission and the Parliament are both backing a new €5.1 billion package of funding called EU4Health. It's seen as the long-term response to COVID-19. What are your spending priorities?
Thank you for this opportunity. And one thing that we have seen is that the EU citizens want more of Europe in the area of health. And this is why we put forward an ambitious EU4Health programme of 5.1 billion. It aims to support building up the resilience of health systems, strengthening the mandate of ECDC and the European Medicines Agency, and also focusing on areas such as the Europe's Beating Cancer Plan and the new pharmaceutical strategy.
EU4Health places a lot of faith in technology. It's asking us to share data across borders, to embrace digital health solutions. It's asking us to trust those systems. How do you ensure that we will trust those systems and we will use them well?
Creating a European health data space has always been a priority for this Commission. So this is about using health data in a safe way, protecting health data in order to be able to increase access to health services, patient care, and optimize the use of data in the area of health. The potential for the use of artificial intelligence, is enormous.
Commissioner, thanks very much for being with us here on Euronews. Now, earlier I spoke to 3 MEPs who were either rapporteurs or shadow rapporteurs on the EU4Health programme to hear their vision for European health strategy, starting with Portuguese MEP Sarah Cerdas, who says health is now part of every policy decision.
We're going to see in each piece of legislation what are the direct and indirect consequences for health of the populations. And this is of the utmost importance because with this approach, we're going to reduce the health inequalities across the European Union.
Now, the creation of a secure digital space to share health data across borders is a key part of the EU's vision. French MEP Véronique Trier-Lenoir explains why.
Medical data, scientific data, must be compiled into big data and analysed by artificial intelligence to allow everyone to benefit from medical advances that are better adapted to the individual, personalised. That's true for cancer treatment too.
One of the aims is to use technology to reduce inequalities, according to Romanian MEP Cristian Silviu Buzoi.
So someone which is in a rural area and have a very difficult disease, a very special disease, could be consulted by a professor from a big university hospital via telemedicine, and even make interventions with the help of telemedicine, because, as I said, artificial intelligence and 5G will change a lot how medicine will work in the future.
Well, you can read more about the latest trends in healthcare on Euronews.com and take part in Healthcare Week by telling us the changes you'd like to see via our social media channels.